Off. There we go. Hello, everybody. Thanks so much for joining us today. We're happy that you're here for the Strengthening Public Health and Healthcare Relationships for Infection Prevention and Control, which is a virtual workshop for NACCHO members. My name is Jennifer McKeever, and I am here today as a partner of We Public Health, or Women Entrepreneurs in Public Health. We are a collective of over 40 independent consultants in the field of public health who are working with organizations and people to create a more just and equitable world. I am honored today to be joined by We Partners, Karina Kelly, Dr. Joy Washington, and Laura Runnels. Dr. Joy Washington and Karina Kelly will be our primary presenters of information today, and Laura Runnels is going to serve as our MC and guide you through this workshop to make sure that you get the most out of it. I'm thrilled to have them here with us today. We put their bios in the chat, and with that, I'm going to go ahead and pass it off to Laura, who's going to kick us off today.
Hi, everyone. It's so exciting to see the room filling up. I'm really excited to spend the afternoon with you today talking about partnerships. All right. More people are trickling in. So let's talk about why we are really here today. And I want to see how many of you are familiar with this quote. So drop something in the chat box, an emoji, a simple yes in the chat box, or give me a reaction on your Zoom screen if you have heard or seen this quote before. Alone, we can do so little. Together, we can do so much. Who's seen this before? Sandra's with me. Braden's seen it. Cassie, Catherine. All right. Folks are familiar with this quote. Nicole, yeah, we've all seen it before. I bet you've seen it a lot. On slides, at presentations, you've heard it in opening remarks, keynote speeches at conferences, and you've probably nodded along thinking, yeah, absolutely. This is so true. And it is. Partnerships, working together is really essential in public health. But we can also be real. Partnerships are hard. They are really, 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 really hard. I know that, like me, you've all sat in meetings before where people are speaking a different language than you are, the jargon and the alphabet soup they're speaking, where you are watching a carefully planned project that you've worked on kind of crumble because you're having a miscommunication, or you are feeling frustrated because you are trying to get information that you need from someone, but you can't because they've been burned in the past by someone at your organization and it's hard to work with them. The reality is that while most of us, all of us, believe in the power of relationships and partnerships, they are really challenging to build and maintain. Especially in the high stakes world of infection prevention and control. And that is why we are all here together today. We are going to change that conversation with you today. Instead of just talking about why partnerships are important, today we are going to dig into the messy, complex reality of how to actually make partnerships work. So I just want to go over right quick some of the learning objectives for today. So our hope is that by the end of our 4 hours through today, that you think a little bit differently about how to approach your partnership challenges, that you can differentiate different types of partnerships across a spectrum, that you have applied a little bit of self-reflection and you've identified some different ways to build trust and strengthen your partnerships for infection prevention and control, and that you've picked up a few new strategies to overcome some of the common barriers to IPC partnerships. This is how we're going to spend our time together today. We're in an opening session now, and then Joy and Karina are going to talk to us a little bit about partnerships across the spectrum. They're going to go into why partnerships are so dang hard and all the different ways that partnerships can look. Then we're going to have 2 blocks where we go into strategies to strengthen and sustain relationships. We'll have a break in the midst of that, and then we're going to have a session to pull it all together and close us out for today. And I hope you are in the mood for some interaction, because we have a lot of breakout groups planned for today as well. Okay. I mentioned interaction, and I hope you are ready for it. So we are going to get started with some real talk introductions. So I'm going to break us out into breakout rooms for some quick, rapid introductions. So we're going to have, I believe, 3 rounds, and you'll have about 3 minutes each to introduce yourself to the person in your room, to the partner in your room. You're going to share your name and your health department, and then I want you to complete this sentence. The hardest thing about building partnerships for me is blank, and then I want you to tell the person why. So again, the hardest thing about building partnerships for me is blank, and then tell the person why that is the hardest thing. All right, so we'll move you through the room. So it'll be a series of 3 breakouts. In each room, you'll get to meet 1 new person, hopefully. And then I'll move you through the breakout rooms in rapid succession. All right, so we are going to get you started. The numbers keep changing on me, so I have to, okay, I think we should be good now. All right, I'm going to open up the breakout rooms now. Ready, set, go. Okay, I'm going to drop a link to a Miro or a Menti poll in the chat box right quick. And I want you to think about your most challenging partnership with a healthcare facility. Again, think about your most challenging partnership with a healthcare facility, and head to the Menti poll that I just dropped in the chat box, and think of 5 words that you would use to describe that healthcare facility. And if we can, keep it PC or PG-13 and PC, I guess. But think of 5 words that you would use to describe that healthcare facility, and enter them into the link that I just dropped into the chat box. So head to that Menti poll and think of your most challenging partnership with a healthcare facility, and drop them into the poll in the chat box. Okay. Challenging. Your most challenging relationship with a healthcare facility.
Yeah, it looks like the question says successful, but let's start
Oh,
with
I'm so sorry.
challenging.
Yeah.
Let's just pretend it says challenging.
Oh yeah, I'm sorry, y'all. I accidentally skipped ahead 2 slides. We'll go backwards and do the other. Okay, apathetic, not communicative, unengaged, guarded, defensive is a big one, unresponsive, hostile, untrusting, We're going to say that we're going to pretend that says unreliable. Okay. They don't have much time for you. They're unresponsive. Yeah. Okay. A lot of turnover. There's a lot of new staff. They're afraid and they're hesitant. There's a knowledge deficit. Wow. I see some thumbs up coming up too. People agree with a lot of these. Okay. And then since I messed up a little bit, let's see if we can do your, we're going to pretend like this says most successful IPC partnership. What about your most successful IPC partnership? Think of 5 words to describe your most successful IPC partnership and enter those words one at a time. Proactive, transparent, symbiotic, driven, friendly. Trusted, appreciative, driven, eagerness to learn, engaged, cooperative. Wow. Okay. I can just feel Joy and Karina's mind spinning with with the words that you're using here to describe these 2 partnerships. So I'm going to hand it off to Karina now to get you started with thinking about partnerships across the spectrum.
Yeah, great exercise, Laura. Thank you. So in this section, thank you everybody for participating and for providing your feedback. I think that was really great for us to see as we kind of move into this segment. And so in this segment, partnerships across the spectrum, we're going to be exploring why building strong partnerships is often challenging. I'm going to let you know up front that this is really not a checklist. This is not really a plug and play, like Laura said. We really, partnerships, there's really no magic formula to collaboration or smooth or seamless way. So instead, what I'm going to do is invite you to do something a little different. We're going to pause, have a chance to reflect and to widen our perspective and our lens. Because when we think about partnerships and when they feel difficult, our reflex is often to make assumptions based on maybe some expectations that we set of others that they may not be aware of. But the truth is that there's usually something deeper at play, something underneath the surface we might not even be naming. So in this section, we're going to be, instead of rushing to solutions, we're going to be slowing down, taking a moment to breathe, and stretch our idea of what we think about partnerships in the first place. So my first invitation is for you to pause and reflect in this exercise. So I think I have control now, right? Laura, let's see. Perfect. All right, so your first reflection. So first, let's take a moment to look at this image. How many black dots do you see at once? You can feel free to type that within chat. It's how many do you see all at once? Seeing 2, 3, 4, 12. It keeps changing. Great. Yes, it does. Okay, 4, illusion. Yeah, agreed. It keeps changing. So you are absolutely correct. So most people can't see all 12 dots at the same time. And that's because our peripheral vision is limited. And when the brain can't quite make sense of something, what it does is it fills in the blanks. So now here's something interesting. We do the same thing when we think about partnerships. We often fixate on one dot, a tension point, a delay, a missed expectation, and then we build a story around that single moment. But what if that moment isn't that whole picture? What if the real reason behind the tension aren't personal, but more structural? What if they're rooted in, funded restrictions, some of the things that you named, some, time constraints, competing timelines, or different organizational pressures? So let me ask you this. What's one dot you've been focusing on lately in a partnership? What might be in your peripheral, something influencing that dynamic that you haven't fully seen yet? So let's widen that lens a little bit and look at one of the biggest sources of misunderstanding in partnerships in IPC and some of the systems that are at work. So here's really the biggest blind spot we face in collaboration, especially when we talk about public health and healthcare facilities. We're operating in different systems, even though we have a similar mission. One of the missions is that we both want the same outcomes. We want a healthy, thriving community and people. But we are built to function very differently. And yes, I see your message. Will the slides be shared? I believe so. So public health and healthcare, as public health is more designed to prevent and to plan. We're seeing that broader forest, right? Instead of just looking at a single tree. Where in healthcare, it's designed to respond and to treat, seeing urgent needs of a patient and seeing that one single individual. So these differences create some flaws in some of those tensions. They are reflections of how these systems are built, but they do shape how we communicate, sometimes how we prioritize, and how fast we move. It's not about who cares more, it's more about each system and what they're accountable for and how those structures shape that behavior that we're seeing. So if we don't name these systems differences, we risk misinterpreting each other's actions as apathy or resistance or disengagement, when reality is that it could be this just a structural design, right? So if these structural differences shape how we behave in partnerships, what does it mean for how we interpret each other? So let's zoom in a little bit further on some of these expectations and some of these assumptions and how we respond when things don't go as we plan. So think about one partnership, for instance, some of those ones that you were naming off, those 5 different ideas, right? Of what maybe would be challenging or maybe successful. So thinking about that one partnership in your IPC work, holding on to the relationship in your mind for just a moment and asking yourself a couple of questions. What do I expect from them? What do I assume they understand about these expectations? And how do I respond when these expectations are not met? So what systems, now it really comes like this shift, right? So what systems are they working within? Like, again, I mentioned some of the policies or some of the constraints that they may have, some of the understaffed, somebody mentioned about being understaffed or overwhelmed, and lots of turnover or reacting to crisis. So sometimes that feels like resistance is actually just the role or the pressure underneath that role, that time crunch, and maybe some of those rigid structures. So more that we look at these partnerships through the lens of curiosity instead of blame, the more we can start to see that it isn't personal, that it's more systemic. And that our awareness, it changes everything. So this shift from blame to curiosity is really powerful. So let's apply it. So you're going to explore a partnership through a different lens using a tool that helps uncover what's beneath the surface. And so within this exercise, this will be in small groups. So what's beneath the surface is really an opportunity for you to just explore with your small groups. Is kind of using this iceberg, right, to map. So it's like what we see on top, you know, it really doesn't measure out to what's really at the bottom. So above the waterline is what you see or feel, the behaviors, attentions, those surface level dynamics. But below the surface, maybe some of those root causes, some of the things that I just mentioned, maybe those organizational priorities or structural barriers or equity issues or burnout. So as a group, I believe Laura will put us in different breakout groups for a little while to talk about these two, what's above the water, what you see, and what's below the water. And then we'll come back here and discuss that.
Yeah, all right, everyone. I just dropped the instructions for the breakout group activity into the chat box. So I'm going to send you into your breakout rooms. I would encourage folks to grab that link there. It's got the instructions. And you're going to be thinking about that challenging partnership that you had in mind when we did the word cloud activity. So I'm going to send you into your room. You'll be with 3 or 4 of your colleagues from the in the room today, and you'll have about we may not do the full 15 minutes. We'll see how much time we have, at least 10 minutes, between 10 and 15 minutes, and then we'll come back and do a quick debrief. I'm going to send you to your rooms now.
All right, everyone. I think everybody's making their way on back. So welcome back. Hope you had a great discussion. So I want to take a moment to debrief, and anybody who'd like to share, I think we had about 5 different rooms open. So just ask, you know, what did you notice as you mapped out your partnerships and kind of seeing what was at the surface level versus, you know, what came up as maybe some of those root causes or what's beneath the surface that we don't typically see. If any group would like to share anything that they maybe noticed during this time, or anything that maybe was surprising or interesting.
Want us to come off chat or type it in the, come off mute or type it in the chat, Karina?
Yeah, either one. If you'd like to come off mute, feel free. If you'd rather type it in the chat, that's fine too. But we'd love to hear from you. So if you'd like to say out loud, what were some of the things that maybe surfaced to the top from your groups?
I can speak for my group.
Yeah, absolutely.
So we talked about what surface, like what's on the surface is naysaying. A lot of you ask for a supply to for testing for different infectious control measures or infectious testing for infectious diseases, and we get a lot of no, we don't need that, we don't need to stockpile that, that's not something, we can't afford it, it's not a value. And then we put what's under the surface is profit over patients, especially in the for-profit industry. And then we mentioned the paradigm shift of not being supportive of preventative measures in infection control space. So that's what we were talking about in our group.
Great. Thank you for sharing, Kelly. Appreciate it. So Maria is saying there's similar barriers, such as lack of leadership or support from partners, lack of shared goals and resources.
Just going to add to what Kelly had said. It was also in her group, but as we were talking, we kind of were, discussing different partnerships that were successful or less successful. And a trend was when what you mentioned briefly about that non-profit versus profit model being sort of the under the surface thing that can affect culture. Like the non-profit nursing homes, we both, two of us had these successful partnerships, sort of the star pupil that wants to be proactive and be engaged. They were for the veterans home. So there was additional support funding. In my case, they are state employees, so they have union protection. They have like very strict communications within the facility, so that someone is safe to say, hey, this is out of whack. Can we, change this? It just creates that culture of safety a little more than perhaps some of the for-profit entities. If you're the squeaky wheel, it's sort of like, I don't know, not safe to bring it up.
Right. Thank you for sharing that. I appreciate that dynamic and that perspective of you. Anyone else like to share before we move on to the next? So I hope this exercise brought out, just opportunities for reflection, not only just, personally looking at some of the partnerships that you engage with, but also kind of seeing it from a different lens in those and other individuals and kind of what some of those challenges. But then also kind of digging a little bit deeper and kind of seeing maybe what's underneath the surface that we're not seeing, that we're not maybe told about, just so that we can have a better understand of really where the tension is kind of driving from and how we can help shift or transform or change our perspective to help shift the dynamics, and make things that work. So from moving from tension to transformation. So why is all of this, why does this matter? So it really matters just understanding that, like, again, the root causes of those tensions isn't just about, reducing the frustration, but also building some sort of empathy, understanding where our partners are coming from, what kind of stresses they're going through as well, aligning our expectations or finding some sort of solution to meet in the middle once we understand kind of what they're dealing with, what we're dealing with. It's also about leading some of those partnerships more effectively, so we can drive those health outcomes, right? So of course, it's not easy work. There is no one size fits all. There's no one size solution. But these insights that have surfaced today are hopefully a little bit part of your toolkit and help you to, expand on your perspective. So now that we've named some of those challenges and seen kind of what lies beneath, I'm going to pass it over to Joy, who is going to guide us through how we actually categorize and strengthen our partnerships. So moving from transactional to transformational, where the real change happens.
Thank you, Karina. We have covered a good bit of information so far already. And we're going to do some more in terms of reflection around what do these different types of partnerships look like across the spectrum, and why are these partnerships so different, right? And so Karina mentioned earlier about, different systems and a shared mission. And so I want you all to start thinking about those partnerships that you discussed earlier, right? I want you to start thinking about your own place where you are. Like, why are you here? Why do you do this work? Right? What is your mission? Just think about that, right? And what we have to realize is that we're all trying to achieve something similar, right? But the way that we achieve that might be different. So I heard some of you mention earlier about, you are working in the health department is more preventative, right? Whereas healthcare facilities, you do have some that are the profit over patients, right? But why are you here specifically? What is your mission? Why do you do the work that you do? And you can feel free to just reflect on that, or you can put it in chat. Either way, we would love to hear it. But just think about that. And I'll give you a few seconds to reflect on it. So, as you think about your mission and why you do the work that you do, think about your partners. Why are they doing the work that they do? What is their mission? How are your missions aligned? Right? And when we start thinking about, when we are very clear on the mission that we're working towards, and we can see our partners and how they are working towards the mission that they are working towards, we can start to think about what our partnerships might look like and how we may be aligned. And these things fall on what we like to call a partnership spectrum. Okay. And there are different ways that these show up. Okay. So, one particular way is no partnership. We don't want to work with anybody. We don't want you in our business. You stay over there, and I'm going to stay over here. Right? Drop a one if you've seen that type of partnership. Drop a one in the chat if you've seen that type of partnership, or you can do an emoji. Right? Because a lot of times what we're thinking is we're thinking about all those challenges that we did in Menti, all the frustration, all the turnover, all the new staff. These people, they're not seeing things the way that we see them. So what's easier than partnering with other folks and getting frustrated? It's easier to be by myself. I can do it better by myself than I can do it with somebody else and have all these challenges. But is that really the case though? We have to think about that. Is that really the case? Because when we're in a situation where there's no partnership, we're operating independently, we have minimal to no communication or collaboration, right? And when we don't know what the other person or the other organization is doing, a lot of times we're doing the same things, right? We have a duplication of effort. Sometimes there's a gap in services because we're not even willing to communicate, right? There are a lot of missed opportunities. There is inconsistency, right? Um, because there's a lack of shared goals or even that mutual awareness, and communities aren't able to get consistent care, right? A lot of times we can have reduced efficiency, right? And then that impacts the public health initiatives and the care that communities or patients receive, right? And then because we're saying no, we don't want the partnership because we don't want to be frustrated, we don't want to be challenged. Then what happens? We have increased burden on both sides because we're not willing to find any kind of middle ground, right? So this matters because when we're building any level of partnership, we have to get to a place where we are moving towards networking and collaboration. And the first step to that is identifying where we are working in silos. Okay. Where we are working in silos, start breaking those barriers down, start aligning resources, and then ultimately we can start moving towards improving health outcomes. But if we continue to stay in a place where there is no partnership, it'll be very difficult to see our health outcomes improved, right? Then once we start kind of breaking down those barriers, we've decided, you know what, we're gonna open ourselves up. We're gonna start exploring some partnership opportunities, right? This can start to look like what's called a transactional partnership. Okay, it's a little bit better than not having a partnership at all, but it's still a very limited partnership, right? So when we're talking about a transactional partnership, this might be more compliance focused, right? We might be sharing things, but we're focused on more of a one-way communication. I need this data. I need these reports. I need these materials, right? So we're focused on informing and even perhaps consulting, right? There may be some cooperation there, but the communication is very reactive. A lot of times that there's contact when problems arise or reports are due. When something comes up, then we want to talk. Right. But we are not being very proactive in the way that we communicate. A lot of times the transactional partnership happens in the resources and capacity that's limited. It's not a very complex partnership. It's you give me this, I give you that, and that's it. That's the extent of it, right? We're not really collaborating, right? The information sharing is limited. Sometimes it might be on a legal basis. Like we're just sharing what is legally required, right? And then it can turn into a adversarial mindset as well. This is it's us versus them, right? We're gonna get our stuff and they gonna get their stuff, and we are cutting it off right there. We are not trying to go forward. So think about the partnerships that you've had. Would you consider any of them as being a transactional partnership? Does it only go as far as give a little bit of a give and take on a very limited basis? I see some ones in the chat. If you've seen or been a part of a transactional partnership. Okay. So as we move forward in our partnership spectrum, we have the ability to move towards something that's called a transitional partnership. Now, a transitional partnership is going to move us even further forward than the transactional partnership because now we're focused on engaging with one another. We're focused on collaborating with one another. We're focused on having regular communication with each other. And we're sharing some of those goals. We're saying, okay, we're both trying to support patients, right? We're both trying to educate people about this particular illness or this particular infection, right? We're both trying to get communities these resources. How do we come together and how do we do that in a collaborative way? Right. That means that we have to do some planning. That means we have to do some organizing. That means we have to do some communication. That means we have to know each other's resources and capacities, right? That means we have to do some problem solving together, right? On those challenges. We have to recognize, being respectful of each other, recognizing each other's expertise and our constraints, right? So then we start transitioning into being more collaborative. Okay. So I'm gonna switch it up. Drop a 2 in the chat if you're following me. Drop a 2 in the chat if you're following me. We've gone from no partnership to transactional partnership. Now we're focusing on transitional partnership. Okay. Then we get to the ultimate partnership. We can even go further than transitional partnership. When we get to a place where we're really focused on a shared vision, and now we're not just thinking about the minimum that we can do, but we're thinking about how do we change the system together. When we start thinking about sharing our challenges together, getting vulnerable together, that's when we start moving into transformational partnership. You see these two folk hugging on this screen? Do you have a partnership with an organization that you can wrap your arms around them and they can wrap their arms around you and you all can lead together and work together and make an impact together and you in this for the long haul? That's the kind of partnership we want to see. We want to see some transformational partnerships here. Okay. We want to start thinking about, yes, there's going to be frustrations. Yes, there are going to be challenges, but how do we overcome that together. Think about any of the relationships that you have, right? Any of the relationships that you have built, friends, family, parents, siblings, whoever. Transformational. Think about the transformational relationships that you have in your life. This is the same thing, right? We want to be able to co-lead together, see that collective impact. We're going beyond just one individual, one patient. We're transforming communities. We're transforming cities. We're transforming everything. We're transforming systems. We're transforming policies. And we're able to do that together. This is the deepest and most complex form of partnership because we're committed to more than just what's in front of us. We're committed to the vision that has not come into fruition yet, right? That takes a lot of trust, and we're going to get into that next. But that takes a lot. It's an investment. It's a long-term investment, right? It's going to take continuous communication. We've got a lot of things to uncover in the process, but we're doing it together. We're building relationship in the process, okay? So let's start thinking about how do we make the shift? How do we go from silo? If you're finding yourself, hey, I'm feeling like I'm in a silo. Don't try to go from silo to transformational overnight. It's not gonna work. I'm telling you, it's not gonna work. But what we can do is we can say, how do we go from silo to at least move into it to transactional is not always bad. Okay. We have to move slowly, right? So we have to build trust in the process. So okay, if an organization needs the data, if they need the reports, if they need how do we start building relationships through that process, right? How do we start building with communication? Okay. Because reactive communication can sometimes be better than no communication, right? So, how do we start the process? Then, how do we start thinking about moving from transactional to transitional? How can we start improving that coordination? How can we start thinking about what are the mutual benefits? How can we start aligning our processes? And then, how do we move from transitional to transformational? Take it step by step. How do we start sharing our power, our resources, our outcomes? How do we start building trust? How do we start building towards that long-term vision, making that come together? Okay, I see Jennifer in the chat. Yes, we are looking forward to seeing you come back as well. All right. So how do we start thinking about making this shift? So what we're going to do next is we are going to go into an activity, and I'm going to show you a graphic of this partnership spectrum. So I know it's a lot. It's a lot happening on this screen right here, but really it's just putting together what we just talked about. So you'll see across in the black arrow, we got silos, transactional, transitional, and transformational. So you'll see the little person sitting in the box, you by yourself, you're not trying to talk to nobody. You say, go stay in your cubicle, go stay in your building, go stay over there somewhere, right? No real partnership. Between silos and transactional, you see one-way sharing. We're just sharing the information that we need to share. Then we're moving from transactional to transitional, right? We start having some limited interaction, but it's a little bit more than one way. We start building that joint input and feedback loops. Okay. But sometimes that power can still be unequal, but it's a little bit better than what it was. As we start moving from transitional to transformational, you can see that we have shared responsibility, joint decision making. And then we start moving to building that power together. And then as we move towards the end, we're building long-term trust-based partnerships. So the waves are increasing, the frequency of that communication is increasing as we go along the way. So what I want you to do is look at this graph, right? And we're going to go into breakout rooms for a few minutes. And I want you to think about those partnerships that you discussed earlier, that you identified earlier, and think about where do they fall on this spectrum? How would you describe the partnerships that you have had? So I'm going to turn it over to Laura if you want to give further instruction on the breakout rooms.
Yeah, I'm happy to. All right. We're going to go into our breakout rooms. You're going to be with the same groups that you were with for the previous activity. Once again, I'm going to drop your instructions into the chat box. And I would encourage you to grab the link that is in the chat box so that you can have it when you go to your breakout rooms. So you're going to map your two partnerships you had in mind on the spectrum, and then talk about why you think they fall there and where you would like your partnerships to be in the future. All right, I'm going to open up the breakout rooms now, and you'll have about 10 to 12 minutes in the breakout rooms to chat.
Back. Welcome back. Welcome back. Hopefully we got everyone, Laura, is everyone back in the space, or are we still waiting on some folks?
We're good to go.
All right. So it looks like you all were having some very good conversations. I'm sorry we had to break that up early, but you will have more time to talk in a few minutes. But I want you to drop in the chat which one of these four categories on the partnership spectrum did you identify for your partnership? So just type in the chat, was it silo? Was it transactional? Was it transitional? Or was it transformational? Maybe you were in between, maybe it was a mix of both, or two or more categories. Where did you find yourself on the spectrum? Just type the word in the chat. All right, so we got some in-betweeners, silos, transitional, transactional and transitional, transactional. Okay. Let's see. Anybody else? What you got? Okay, I see them rolling in. So it looks like we got some folks more on the transactional side. I see one that says transformational. Megan says, I have some anxiety about that relationship remaining so in the future. Okay. So definitely we can see some challenges when it comes to transformational partnerships as well. Transactional moving. Kelly says transactional moving towards transformational. Okay, great. So it looks like we are working towards identifying kind of where we are on the spectrum. And the beautiful thing about this is because we have spent time identifying where we are on the spectrum, now we know how we can move forward and what we are moving forward, how we are moving forward and what category we're trying to move towards. So that is good. Okay, so let's move to the next section. So we're going to talk about strategies to strengthen and sustain relationships, because at the core of all of these relationships or partnerships, it doesn't matter where you fall on the spectrum, at the core of all of these partnerships is trust. The thing about it is, what degree of trust have you spent time building? Okay. So I want you to take 30 seconds. Don't put it in the chat. Well, you can put it in the chat if you want to, but you don't have to. Get a piece of paper, get a pen. What comes to mind when you hear the word trust? Just write the first three words or feelings that you associate with the word trust. Take about 10 or 15 more seconds and just think about what are the first three words or feelings that you associate with the word trust. Okay, and I see Megan put in the chat, know what to expect, right? I see Nicole says reliance. Okay. So now I want you to think about something else. And remember, I mentioned earlier about building relationships, building partnerships, right? And thinking about the people in your everyday life, friends, family, neighbors, whoever. I want you to think about, who do you trust? Who are the people? Name them, internally. Name them, not in the chat, but name them, right? Who is it? And why do you trust them? What have they done or not done to build that trust? Take another 30 seconds and think about that. Okay. I see some things coming in the chat, right? So that trust can be built on things like support. How supportive are they? Um, Unconditional support. They support me no matter what, no matter what's going on. I know I can lean on them. I know that I can rely on them. I know that they have consistently shown up. They've shown me who they are each and every time, right? The same thing applies when we're talking about partnerships between organizations. There's a reason why your organization trusts another organization or not, right? And so we have to start thinking about, what does trust look like organizationally, right? Are we being consistent? Are we showing support to one another? Are we investing the time that it takes to build that trust? The trust that you have with those individuals who you were thinking about, was that trust built overnight? Drop a one in the chat if that trust happened like that, like it was just overnight. Drop a one in the chat for me. Yeah, not seeing anyone. Yeah, that's what I expected. Not seeing any ones, right? Because trust isn't built overnight. Relationships aren't built overnight. So same thing applies with organizations. So what we're going to do is we're going to do a little bit of a case study, right? Because we want to look at how those relationships can differ across the partnership spectrum, but we want to ground this in a real world scenario. So we're going to walk through this case study together, and it's going to illustrate kind of what happens when partnerships between public health and healthcare organizations start to break down. So we have three parts that we're going to go through. And so what how it's going to work is, we're going to read each section. A member from our team is going to read each section out loud. And then after each section, we'll break out into small groups and we'll reflect on a few discussion questions. Okay. Then we'll return to the main room and we'll talk through some strategies. Okay. Um, and really think about this from a trust building lens. So our case study today is the Riverside County Health Department and Sunset Care Network. Okay. So if I believe, is it Jennifer? You got the first
Yep.
one? Okay.
All right. Here's part one of our case study, and it is the nightmare. So Sunset Care Network operates three small long-term care facilities, 45 to 65 beds each, in Riverside County, serving predominantly Medicaid residents. The facilities provide skilled nursing care, memory care, and rehabilitation services to a population with complex medical needs. Over the past 18 months, infection prevention has become a major challenge across all three facilities. They've experienced multiple outbreaks, including COVID-19, influenza, and a particularly severe C. diff outbreak that spread between two facilities when a resident was transferred. Staff turnover has reached 40% annually, and many new hires lack the experience with infection prevention protocols. The facilities share an infection preventionist who splits her time between all three locations, but she's often overwhelmed and reactive rather than proactive.
Thank you, Jennifer, for reading part one. So now what we're going to do is, I want you to think about these two questions as you go into your breakout rooms. Number one, what is the first thing that comes to your mind when you hear or read this part of the case study? What assumptions are you making, right, about the facility or the staff? Okay. And then number two, what needs, both seen and unseen, can you identify for this facility, whether it's staff, it's residents. What are you seeing as far as needs are concerned? Okay, and Laura has dropped the first part of this case study in the chat. So I'm going to turn it over to Laura for further instruction on your breakout groups.
All right, everybody, you know the drill. I encourage you to click on this link and grab the chat, and it's just above Megan's comment there. Click on the link, grab the part 1 portion of the case study. The questions are in that document. I'm going to open up the breakout rooms, and you are going to have about 8 minutes to discuss this section of the case study and answer the questions, and then we'll bring you back for a little bit of a debrief. All right, I'm going to send you to your room.
All right, so hopefully you all had some good discussion. If you will just put in the chat, we're going to keep moving forward because of time. But if you would just put in the chat, what were some of your responses? What were some of the assumptions or the needs that you made about this particular part of the case study? Just put it in chat for me as we move forward, okay? So when we think about what is trust, right? Trust is confidence, right? If you have trust, you have confidence that people are going to act with integrity, reliability, shared purpose, even when things get hard. That's when trust matters the most, when things get hard. So we have some things here that of what trust stands for. So trust stands for transparency. We need our partners to be transparent with one another. We need respect. And it doesn't matter wherever you fall on the spectrum. You're going to need these elements. You're going to need understanding, right? You're going to need steadiness, that consistency, right? You're going to need to communicate openly, especially when those challenges arise, okay? And time, we already mentioned it earlier, it takes a lot of time to build trust, okay? And there's this saying on the slide that says trust isn't given, okay? Trust isn't given, it's built through consistent action over time. I see some things in the chat that says IP needs more access to resources and education. They need better staff, onboarding, and education. Okay. Staff in the IP are stressed out. Our outbreaks are a lot of work. These folks are stressed and they're probably tired and they're exhausted and things are getting lost, right? But if we're able to find an effective partner, we're able to build trust. Think about how that could help in this particular case study. And we have a little diagram here that illustrates that trust is at the foundation. Trust is at the center. If you take nothing else from this workshop, remember this from at least my portion. Trust is at the center of everything. Okay, so when we're talking about public health and healthcare partnerships, trust isn't just a value, it's the infrastructure that holds everything together. So when we start looking at how it's all connected, how health departments communicate with healthcare facilities, how health departments communicate with the communities, how communities and patients work together, how patients and healthcare facilities work together. If at any point trust is broken between these entities, we have a problem. Okay. Each one is connected to the others through relationships, communication, shared responsibility. And you see that trust is flowing in both directions. Okay. So we have to make sure that we are focused on making sure that we're not eroding trust, and not just between those organizations, but with the very people that we're all trying to serve. Remember that shared mission. Okay. So remember, trust is at the center. And think about the case study and think about it in terms of trust. Where might trust be lacking? Where might trust support in this particular case study? So we're going to move to part 2. Okay. Let's move to part 2. Karina, if you will read part 2.
Yeah. So the broken partnership. Sunset Care Network has a required relationship with Riverside County Health Department for communicable disease reporting and outbreak response. However, when outbreaks occur, the partnership becomes tense and adversarial. Health department staff focus on containment and investigation, asking detailed questions about practices and protocols. Facility administrators feel interrogated rather than supported, while health department staff are frustrated by what they see as preventable cases and incomplete cooperation. Recent tensions include facility staff feeling investigated rather than assisted during outbreak response, health department concerns about delayed reporting and incomplete information, disagreements about isolation protocols and outbreak control measures, miscommunication about testing recommendations that confused staff and families, and facility perception that health department doesn't understand operational constraints.
All right. So as you are hearing this particular part of the case study and you're thinking about trust, right? These are the questions I want you to think about. Based on what you know now, how would you describe the current type of partnership between the health department and the facility? Okay. Think about, is it siloed? Is it transactional? Is it transitional, or is it transformational, and why? Okay, I want you to think about that and then think about what are some of the barriers that's keeping this partnership from functioning well. How could trust be strengthened? Okay. So, Laura, I'm gonna hand it over to you. We'll take a few minutes to go into breakouts and come back.
All right, thank you, Joy. I'm going to drop part 2 of the case study into the chat box. Encourage you to grab that link, and then I'm going to send you back into your breakout rooms, same groups, and you'll have about 8 minutes to review the case study and answer the questions, and then we'll bring you right back. All right, have fun, everyone.
All right, welcome back, everyone. So, in the interest of time, if you will put in the chat, what kind of partnership did you all think that this was? Silos, transactional, transitional, or transformational? Any barriers or strengths? Just please feel free to put it in the chat as we continue to move forward. Okay. So, why does trust matter? Okay, because of the types of partnerships that we are building, right? We want to make sure that, remember, trust is at the foundation. Trust is the infrastructure that we're building on, because trust increases engagement. Okay, when we have trust that's present with our partners, whether they're healthcare providers, public health staff, community members, they're more likely to show up. We are more likely to show up, to speak honestly, to stay committed to our shared goals. Then trust improves our communication. Think about the people you identified earlier in your life. When you trust them, you can communicate with them, you can talk with them, you feel safe giving and receiving feedback, raising concerns, asking for help, addressing challenges together, right? Especially when you're navigating urgent or complex health issues. You have to have improved communication, but that only works if you have trust, right? A lack of trust leads to resistance. Okay, so if we have trust, we have reduced resistance. Resistance leads people to pull back, avoid collaboration, withhold important information, but trust reduces that resistance and then helps move things forward more smoothly. And then finally, trust promotes shared responsibility for outcomes, because when people trust each other, when organizations trust each other, they take ownership not just for their piece of work, but also for their collective impact, and they're willing to be accountable to each other. Okay. And I see someone in the chat, Braden, put transactional. There's no communications on expectations on what each party needs, right? And so because it's transactional, there's a lack of trust there. We're seeing some resistance there. We're seeing the lack of communication there, right? And the thing about it is, when we're looking at the bigger picture, as we talk about trust, it's important to remember that trust does not exist in a vacuum. It's not about one person or just one organization. Trust operates in a larger system where every interaction, every decision, every misstep can have a ripple effect. Okay. So you'll see in this diagram, we have several different types of entities involved in our health, in in the health of our communities and the health of the system overall. And so you will see, and I think it's the third kind of rainbow looking thing from the bottom. We have health, state and local health departments in here. We have health, tribal, urban health clinics in here. We have healthcare systems. We have all these different things. So if there is trust broken between any one of these areas, it actually is affected within the entire system, the larger system. So remember we had that diagram earlier of the 4 different corners. Well, but those 4 different corners are actually in a larger system. So when trust is broken in any one of those areas, it can continue to affect other areas as well that we might not even be thinking about. Right. So this diagram just helps us visualize that trust or a lack of it is constantly shaping how systems function. So when trust is present, we see stronger relationships, better communication, more effective partnerships. And when it's broken, even if it's unintentional, that can trigger a cascade of disconnection, resistance, or dysfunction across entire communities and systems, not just the immediate players. So, what happens when trust is broken, right? Even with the best intentions, trust can still be broken. And that's okay because the work, the real work, is in how we choose to respond, okay? And a lot of times, trust has been broken and it didn't have anything to do with you. It was somebody else, it was some other organization, but now that trust is broken. So, the question that we have to ask is, was it mistrust or was it distrust? Okay, so mistrust is uncertainty. So maybe people are cautious or skeptical because of past experiences. But if it's distrust, that's rooted in belief. Like people actually believe that you cannot be trusted. That other organization actually believes that you cannot be trusted. So as we think about what does it look like to repair that trust so that we can see our partnerships continue on that spectrum, we have to think about what does accountability look like when trust is broken, and it's going to look differently if it's mistrust versus if it's distrust. Okay, so the methods that we take to repair that trust, rebuilding that trust, means that we have to acknowledge what happened, whether it's mistrust or distrust. We have to own up to it, take accountability for it. We have to have an apology, right? Offer a sincere apology without excuses, but then most importantly, take action. We have to demonstrate change in the process. We have to actually do the work. And remember, trust is rebuilt over time, it's not overnight. So, this is a constant cycle of doing this over and over again. So, in your partnerships, think about, has it been mistrust or has it been distrust? And what does accountability look like on both parts? If you're the one that doesn't trust the other organization, what do you need to see from that partner? What do you need to see from that organization? All right. So we are going to move into the last part of this case study, and I believe, Laura, you have this one.
Absolutely. All right, this is part 3, the solution. Both the health department and Sunset Care want to protect residents, but their partnership has become a cycle of crisis response and defensive interactions. The health department sees the facilities as resistant. The facilities see the health department as punitive and disconnected from operational realities. Now, with new state requirements for enhanced IPC partnerships and families demanding better infection outcomes, could transforming the relationship help both sides and better protect the vulnerable residents they serve?
All right. So as you go into your breakout groups, your discussion prompts are going to be, what would it look like for this partnership to be transformational rather than transactional? How can they move up on the spectrum? Um, or even transitional, if you want to discuss that. But and also what role could shared goals, regular communication, or even joint learning play in repairing this relationship? So we are going to go out into our breakout groups for a few minutes. We're going to discuss, and then we're going to come back and discuss strategies for building and maintaining trust. All right. Welcome back, everyone. So Hopefully you all had some good discussion in thinking about the solution. And as I go through these next strategies, let me know in the chat if any of these resonated with you. Maybe you all discussed some of these in your breakout rooms. And if there are any additional ones that you addressed as well, please drop it in the chat. So let's think about, how do we build and maintain trust, especially when we're working with other partners? Okay, what does this look like in actual practice? So number one, transparency, right? People want to know why decisions are made, not just the final outcome. So one of the ways we can build trust is share why, what, how, even if it's messy, incomplete. Openness builds credibility. Share what you can. And I know there are situations where you can't share everything, right? But share what you can. Be consistent. Show up when you say you're going to show up. Do what you say you're going to do. Okay. That is what builds consistency every single time. If you can't do it, provide a reason. Let somebody know, right? And same thing, are you receiving these things from the partners that you're working with, right? Being culturally responsive. Are you learning, adapting, honoring people's identities, their histories, their values? Okay. We can't assume that our way is the only way. All right. Effective communication. We have to start going beyond just getting our point across. We have to listen actively. We have to speak with care. We have to clarify, check in, good communication. Any type of relationship, partnership is a two-way street. So we have to go both ways. Okay. And avoid assumptions and stereotypes, right? Everyone has a unique story. We want to be curious. People bring knowledge, history, wisdom. We don't want to let assumptions block our connection. So we have to remember that trust is proactive, not reactive, and we don't want to wait for a crisis to start trying to build trust and build our relationships and build our partnerships. We want to build this trust and these relationships before we need them. That's another key part of this, okay? And remember, let me know if any of these resonated with you in the chat. Did any of these come up in your conversations in the breakout rooms? And if there were any that did not, that I'm not saying, please drop those in chat as well. Some more strategies, okay? Trust is not a checkbox, okay? It's a relationship that you build with one person, one organization, one moment at a time. If your relationship is not connected with individuals, it can't be connected with that organization, right? It's not a fast track. Okay. So we have to make sure that we understand that our relationships and our partnerships are our most powerful resource, and we have to take the time to invest in them. If you don't know, ask questions. Okay. Don't assume that you know what matters to that other organization. Don't assume that you know what's happening with their stressful environment or their burnout. Okay. Be curious, ask, listen, learn what they value, understand how they see their world, how they see their interaction with their patients, right? Of course, be yourself, right? Be authentic. Be authentic in your professional and your personal ways, your attitudes. Be yourself. Share what you genuinely care about. Build relationships before you need them. We just talked about that. Resist judgment, right? Ask, what's the full story? Give people the benefit of the doubt before offering solutions, and try to understand what kinds of solutions will work for them, what kind of solutions will work for you, how can you work together. And people want to contribute, so add value, invite participation, think about what you can offer, and they will think about what they can offer you as well. People want to contribute, but they have to feel valued. Are you making that organization feel valued in your partnership, and are they making you feel valued? Okay. Extend an authentic invitation to join, to lead, to co-create. And as we start to move into break, right? We move into the next portion of our workshop. Just remember that trust is earned, it's not given. And ask yourself, what value can I bring to this partnership? It might be tools, it might be time, it might be insight, it might be connection, but whatever it is, you can offer something meaningful and move your partnership across the spectrum. Okay. And I see Jen says, I think identifying and acknowledging the strengths that you see in the facility IP doing is important instead of only focusing on where areas for improvement exist. Exactly. So we want to take a strengths-based approach. Identify what's unique. That's how we build trust in the process. Okay. I'm going to turn it over to Laura.
All right, everyone. We are going to take a break. So I will invite you to get up from your desk, walk around, get a drink of water, maybe pop outside for a minute. Our break is 15 minutes. Feel free to stay logged in, just, turn your screen off or whatever. We are going to get started again at 2:30 p.m. Eastern time on the dot. And we have 2 more sections to go before we close out. And we look forward to seeing you again in 15 minutes. Get started again in just a moment. If folks can let us know you're with us by throwing up an emoji or dropping something in the chat box. Let us know you're with us again. All right, I see some thumbs up. Thank you. Hi, Brayden. All right, great. Okay, I am very excited to bring Karina back to the screen for our next block of the agenda. Take it away.
Great. Welcome back, everyone. I hope you enjoyed your your break. So welcome to this next segment. We're going to be talking about strengthening and sustaining relationships, but through interpersonal skills. So now we're not just here to talk about those soft skills, but we're reinforcing something a little bit deeper, thinking about self-awareness, mindfulness, and interpersonal fluency, which are foundational to how we show up in life, in partnerships, and in things that we do. And so this section will give us a chance to re-energize, be reflective, and also blend in some, exercises, emotional intelligence, and some real life communication tools to help you lead with a little bit more grounding in intentional place. So let's begin. First, I want to start with a quick storyteller. So I like to start with a story. So I think, start pretty much starting with it starts with us. And so the thinker story. So before we kind of connect with others, it gives us a chance to pause and to think. So not long ago, I was in Philadelphia actually speaking at a NatCon conference. And so while I was there, I stopped at the Rodin Museum to see the thinker. This wasn't my first time in Philadelphia. I've been there many times before, and I've seen the statue, but I think this time it was just a little bit different. So it'd been about 7 years since I had traveled back to Philly. And so a lot has changed during that time. I've changed during this time. And so I'm standing there in front of the statue and just looking, what is the thinker thinking? So at first glance, he seems calm. Is he pondering about the future? But the statue is right outside of the gates of hell. So what is he really thinking? What is really on the mind? But you look a little bit closer. See, the muscles are tense. The posture is a little tense. Why? Maybe it's because reflection takes some effort. And this is true also about when we think about our partnerships too. They take some effort, that reflection. So before we build or lead or we can repair or, build trust in relationships, we have to examine our presence. So I invite you to pause and breathe and ask yourself, how do I usually show up in partnerships? How do I respond under pressure? And what do I want others to say about the experience of working with me? Because strengthening these relationships doesn't start, again, with others. It starts from within. So now let's take the self-reflection a little bit further by exploring some of the patterns that tend to show up we bring into some of our partnership spaces. Uh-oh. Too many slides. So looking at some of the archetypes in awareness. So again, we're talking about self-awareness. And so this next concept is not a label, but it's an invitation to reflect on different ways that we tend to show up in collaborative spaces. So these are called archetypes or patterns or different tendencies inspired by Belden's team roles, as well as emotional intelligence research and real-world public health collaboratives. So you might see yourself in one of these tendencies. Maybe you're the fixer who jumps in with solutions quickly, an observer, somebody who's watching and waiting, or the connector who brings people together. Visionary, people who are picture big thinkers, listener, the one who holds that space, that quiet shoulder that you can always speak to. The bridge builder, someone that's always connecting, or maybe you're an anchor. So none of these are wrong. They're just simply patterns, how we may show up. So the key is noticing, how am I showing up right now? And asking, is it serving this moment, or might something else be needed? So as you explore these, ask yourself, what feels familiar? What do I tend to shift into under pressure? And what do I want to shift towards? So let's see how this shows up across the room. And anybody who would like to share, take a moment to look at these choices. And if you would like to share, obviously feel free to type those within chat.
We actually have a
Are we-
poll,
We have a poll?
Karina. Yeah, if you want
Next
to
slide.
click on the link here, it'll take you to a poll. You can go back a
perfect.
slide. You can go, sorry, yeah, you can go back a slide. Like, we won't
there.
reveal the results quite yet, but you can click on the link and perfect. Click on the link and enter how you tend to show up, and in a moment we will show the slides.
Yeah, so again, if you're just joining and if you're joining us a little bit later, we're taking a poll. It's up to you. So just, again, these are archetypes on the screen. So different ways that we may tend to show up. So which one feels most like you, especially in your most maybe recent partnership?
Folks are reading and picking which one they tend to show up as. And in a moment, Karina, I'll let you advance the slide. But what I love about this is that when I'm doing things like this, I'm like, well, duh, like, why? Like, of course, this is the way that everyone would show up, right? But then when you see the results, you see how varied they are, and like, you really do have so many different personalities in the room, and there is a place and a need for all of them. So yeah,
Definitely.
all
Different
right,
strengths of everybody. So definitely
yeah,
good. Definitely good for you.
let's reveal the different types that we have.
All right, the grand finale. Let's see. Hopefully this loads. All right, so we have a lot who are the bridge builder and anchors and fixers. So a lot of, it could tell, public health people in the room. This is what we tend to be, bridging fixing and bridging, as well as anchoring those partnerships. So great. And we got harmonizers, visionaries, and listeners, which are amazing skills sets as well. And definitely to blend those together. So with this, the self-awareness in mind just lets us help us dig into some of these skills that can help us navigate into these relationships with a little bit more clarity and a little bit more care. So what are interpersonal skills? When I say this, what are you really thinking about? So interpersonal skills are something that we use everyday tools to help us connect, communicate, collaborate with others. So you may be doing some of this right now. Hopefully you're actively listening and being present. So they're sometimes called people skills, but that undersells really what the importance is. And so in high stake environments, such as public health care or public health and in healthcare, interpersonal skills are really foundational. In fact, a recent National Network of Public Health report found that essential skills like communication, emotional intelligence, adaptability, leadership are all critical in infection prevention and control success. So some of these soft skills that help us interact and communicate with others, as you can see here, are active listening, but with presence. So it's not the listening that my husband says I do, where he says, you hear me, but you're not listening to what I'm saying, right? So we're here, listening or hearing, we're not really actively present. Regulating our tone under pressure, it's those nonverbal cues that we're giving, showing empathy or cultural humility, asking questions to help with clarity versus accusations, and for feedback on how better can I communicate. One thing we did here with We Team is when we started up our initial projects, we start with what's the best way that we can communicate with you? How do you ask for help? Do you want assistance and help? So it's those kind of clarifying questions that really assist with communications and partnerships and setting the tone. Also setting the boundaries with respect, what your limits are, what others are. And so these aren't just, essential, but, to build trust, what Joy was talking about, and also better outcomes is that we have to invest in these skills, which means investing in us. And so the stakes are high, of course, because it's people. And so people are, our most valuable resource. And as you can see here, it promotes a culture of safety, reduces burnout, increases resilience, and improves morale, interpersonal skills. So why does this matter for our partnerships? And so you can see the IPC work that we deal with stress, as I heard a lot of you say, talked about turnover, new staff, some untrusting, some defensive partnerships, maybe some naysaying, things like that were coming up within your comments about partnerships. So that stress, the urgency, that cross-sector teams and communities that we deal with, as well as the work load that we have. So this means that if any poorly worded email can really erode trust or send somebody above the edge, right? A tense meeting can shut down collaboration, or a lack of empathy can really deepen those equity gaps. And it's actually over 80% of serious medical errors involve miscommunication, not lack of knowledge. So the impact really goes deeper than that. And so interpersonal skills will help us navigate these dynamics and bridge, again, the technical knowledge as well as some of that effective action being our glue. So I love the Maya Angelou quotes. When I was in the military, my mom would send me this book of different quotes to kind of help motivate me along my journey when I was in basic training. And so, but one thing I think that stands out is, people will forget what you said and what you did, but people will never forget how you made them feel. And so that's really an element of what interpersonal skills should mean. So what are some strategies that can help us grow, our awareness? And so really, our awareness is our presence, that our understanding that our presence leaves a trace, kind of like these ripples in the water. When you throw something, it ripples down, creates a ripple effect, right? So after a meeting, how do people feel? Let's say leave a meeting if we're, facilitating. Are they reassured? Do they feel frustrated? Do they feel dismissed? Or do they feel like they know what's going on and we could work together? Are they energized? So emotional intelligence is about noticing these ripples, not only within the social environment, but also within yourself. So as you can see, self-awareness is a behavior. I feel myself getting frustrated, right? Or maybe I pause and take a second to breathe or step away. Self-regulation is having that, calmly, and when you feel tension, is acting calmly when you feel tension. And social awareness, being able to shift energy and tone, remember, and noticing what our nonverbals are saying in an audience. Empathy, I hear their concern even if I don't agree with them. So what assumptions do we bring into interactions, and how do they help shape relationships? Because unchecking some of these assumptions can really cloud our connection, while awareness creates that space with trust. So paying attention to our emotions as they shift during meetings. I don't know if you've ever heard of, I've done with teams, it's called a pulse check. And so if you would like to participate, this pulse check, and I didn't put this in here, but it's a pulse check 1 through 5 is 1, I would do it with my teams, and they would say, 1, I'm, have light work. I don't feel very, stressed right now. 2, 5 is I'm maybe I have a little heavier load and I feel, some level of stress. In a meeting, This would give us clues to let us know that our team, which members of our team were maybe struggling and when we can intervene based on this pulse check. And it was a way to kind of check in with different people. So definitely something to try out maybe at your next meeting. So I also want to share with you is the power of social awareness and really what does that look like? We hear about it. How do we be social aware? And, maybe, talk and discuss this. You just saw it on the slide. Again, those are just words, but what does it feel like? So I don't know if anybody watched the 2024 Paris Olympics at all. But if you did, I am a huge women's sand volleyball fan. Played volleyball, love it, played lots of different sports, love to watch it. And so when Olympics is on, that's kind of like my main sport that I go to. Well, there was one game, Brazil versus Canada in sand volleyball, and it was the third match. So for the finals, the teams were tied. And so this match really determined who was going to win. The tensions were sky high. The players were yelling across the net. A referee was trying to calm them down, but it wasn't working. You could see the tension in their face. You could see the arguments with their hands back and forth. The crowd was on their feet yelling and screaming. The energy was just high. And then something unexpected happens. There's a low sound of music that's playing in the stadium. Can't even hear it, barely faint. But then all of a sudden, you see this crowd, tens of thousands of people all around the country from various different nations, embracing arm in arm and singing John Lennon's Imagine. Imagine all the people living life in peace, you sharing all the world. As they embrace arm in arm, you see the volleyball players crack a smile and clap and nod their heads, and the tension is eased immediately. How is that? The DJ read the energy of an entire stadium, of the room of not only the volleyball players, but also the room of all these different individuals, using social awareness to change the mood of that room. Isn't that crazy? So to sense and to respond and to connect, to be able to read and to understand one another. And so that's really anchors us to awareness with some of those practical experiences. So imagine a new way is what the slide was about. And so looking at social awareness and practical tools that we could use in some of these maybe tough conversations, and still practicing mindfulness and being aware of others, respectful, but navigating through some challenges and keeping us grounded. Our approaches like the IBR approach was interest-based relational. It's developed by Harvard Negotiation Project and really helps navigate challenges in a grounding, respectful way. So the central idea is that people are not the problem is a problem. So what it does, it invites you to set the stage with a shared problem-solving effort, begin with an agreement or listen to work collaboratively. Second, acknowledge emotions, make space for them without letting them derail the conversation. So you could rephrase things like, I can tell this issue is frustrating. Let's pause and name what's coming up from here. We can separate people from issues and avoid language that makes a person, feel like we're accusing. Be curious, but not accusatory. Focus on facts. Identify some of those shared interests or common goals. And after we clarify the issue, we can go beyond that position to those interests, and work towards what we hope to achieve and what part is most important. I do this a lot with collaboratives in community health assessments and community health improvement planning. A lot of the times working with health departments and health systems that are on totally different schedules. But the key for this is finding that mutual ground. So a lot of you who identified as having some skill sets as being the builder and the connector, this is where that skill comes into play. And co-creating the solution, to stay flexible and open-minded, inviting creativity and use yes language to keep the momentum going. So in public health, again, this is essential, but it also essential just working across, different systems with different pressures, priorities, and powers. So the IBR really helps to reduce some of that tension and rebuild trust, focusing on a commonality, a common goal, focusing on people and emotions and handling emotions. So let's see how this works in real life through a scenario many of you us can relate to. So how can you remain calm under pressure? So in this, with anybody who's still around in our groups today, you're in we got a quick scenario practice. It'll be about 10-minute breakout. You'll have a scenario, and then you'll be able to assign a role based on your group and decide, whether it be the public health leader or the hospital partner in this specific scenario, and walk through those steps that we mentioned about the IBR as you're kind of reading, after you read the scenario, and kind of just understand, how would you name the emotion? What shared interest can you center on? And how do you move from that tension to trust? So kind of focusing on, what part, and then we'll debrief on what part would maybe be the hardest for you. All right, I'll pass it over to Laura.
All right. I am going to drop a link to the scenario and the instructions into the chat box. So make sure you grab that link. And then I'm going to open up the chat room. Sorry, I have a rambunctious kitten in my lap. I'm going to open up the breakout rooms, and then you will have about 8 minutes to work through the exercise.
I
Yes.
clicked the link and it has a permissions.
Oh, my apologies. Let me.
Well, welcome back, everyone. I think everybody's coming back from their breakout rooms. So as we've gone through the scenario and you guys were able to do your breakout groups. Oh, not enough time for that one. I knew we should have put more time in there. We were just talking about that. All right. Well, for the time that you did have, let's see what we were able to discuss and talk about. I know that one was probably hitting a lot of realness with that scenario. So was there anything that was surprising or anything that you would like to share? The scenario relate to anything that may be going on, or like any real world scenarios that are happening? Was it hard to stay calm?
Well, one thing at our local health department, we send out public messages, and for example, norovirus, and we would never pinpoint any facility. We would just say, as a community, we're seeing an increase, and this is what we want, proper IPC practices. Let's wash our hands, let's do these things. So that's one thing from a public health. I'd make sure these healthcare facilities know that we're not putting anybody's name in there. It's just a message to the public.
Got it. Definitely. Thank you for sharing. And thank you, Kate, for sharing.
I would just want to just kind of expand on what Nancy was saying, that that I think it comes second nature to those of us on the public health side, that like, of course not, we wouldn't do that. But as we were talking, I realized, you're doing the kind of infection control talk with that IP, like for that scenario to contain the outbreak. And then you also have this public facing side. And so even though it's kind of like unthinkable to us that, like, why would you think that? I would never, blast your name all over the newspaper. This is, it's kind of like, take a second and say, oh yeah, you're hearing me ask all these very specific questions, and I'm not sharing with you, which part of that is for containing the outbreak and which part is for the public. And just kind of take a minute and define that was, helpful.
That's a great perspective. Great perspective. Thank you for bringing that up, Megan. Yeah, so looking at both ends of the spectrum and communicating why are we asking this information. That's really good. And Kate mentioned in our chat is that having been on both sides of this, lack of communication can be very frustrating. And so the concern is real about social media, bloggers, and 24-hour news channels. Oh, yes. Having worked both at the state and with the state health departments as well as health systems, I definitely understand. Anyone else like to share? Well, definitely thank you for your participation and for willingness to, go through a scenario and actually, be able to kind of break it down on and look at both sides. And one thing I want to shift to is really setting aside a time for some micro rituals. We've been talking a lot about interpersonal skills over the last few minutes since we started this session, and about strengthening and sustaining relationships. So we often think about those partnerships as something that we do with others, but it's also about how we are with ourselves. And so one item that is not listed here, but should be practiced first is self-care. Because we're in an era, many of you have mentioned, burnout or maybe reactive or disconnected, as that we can't lead with presence when we can't build trust, and we can't sustain momentum if we're not taking care of ourselves. So invite you to see self-care as not just personal, but also relational. In addition to that, some micro practices that also help make a big impact. Some things that we talked about today, those interpersonal active listening, asking with curiosity versus accusation-based questions, rebuilding that connection, reflecting, and we've done throughout this whole days or half of the day is reflecting on different questions, intentions, our intentionality, assumptions, and sustaining learning, and then empathetic conversations, kind of deepening the trust, seeing both sides, what's above water, right, and underneath, and then ending, the week, practicing a little gratitude, grounding in mindset where you're at. So some of these micro practices have really big effects, like I mentioned before, some of those ripple effects. So what shifts? My last question for you is what shifts? If I can get to it. So pulling it all together. Oh, I don't think we left that one out. Did we, Laura? That last pull, did I pass through it? Yeah. But just, oh, no, yeah, did skip over. Okay. Here we go. So one of the last polls for this section is, what's one of the interpersonal shifts you want to bring into your next partnership interaction? So it can be something we mentioned today, talk about active listening, communication, social awareness, self-awareness.
And we dropped
Taking a deep breath,
a
reflection.
link to the Menti into the chat box. So you're welcome to click on it and drop an idea into the chat box or into the Menti poll.
Great. Getting a lot of good ones in. So active listening, ability to be present and practice some self and social awareness, listening, acknowledging needs and feelings, pausing before speaking or taking a deep breath, responding before reacting, and understanding opposite viewpoints, right? And promoting gratitude. People are not the problem is the problem. Great. And connecting and setting a common ground. Wonderful. Thank you. So definitely great reflections, and thank you all for coming inward and reflecting. So again, this is a chance to reset, to commitment, and to create that ripple effect. So I will pass this over to Laura as she gets into our last session.
Thank you so much. We are pulling into the final session, everyone. We are almost there. We are going to pull it all together now. And I am going to invite you to think of trust as being like a bank account. Every interaction you have with your healthcare partners is either a deposit or a withdrawal from your bank account, your trust piggy bank. So trust, just like a financial bank account, you can't take a withdrawal, you can't make a withdrawal from it if you haven't made your deposits first. And if your account gets overdrawn, if you've made too many withdrawals and not enough deposits, the relationship is going to go into crisis mode. The challenge is that we often focus on the big moments, the outbreak response, the big annual meeting. But trust is actually built through these little, small, seemingly mundane transactions that we have with our partners. And I want us to talk about what drains our trust accounts with our partners first. I'm going to drop a link to a Miro board into the chat, and I would love everyone to join me over there. Whoops, that's not the Miro. Here it is. All right. I'm dropping my Miro board link over there. If everyone can go and join me at the Miro board, that would be fantastic. You'll see my cute little piggy bank.
Hey, Laura, I got a message that's no access to the board.
Oh, 1 second then. Okay. I tested this yesterday and it worked, so.
Did other people have that experience, or were you able to get on?
It was asking for a password.
Okay, yeah. It asked me to request access.
Okay. I'll drop a fresh link and see if this works. Sorry, y'all, I tested this yesterday. I'm not sure why. Yes, I see people popping in. Awesome. All right. Thank you for helping me with that. So everyone's on my board here. You're going to see two sections. I'm going to invite you to come over to the withdrawals section where the pink Post-its are. It's on the left-hand side of the board. And what I would like you to do is on the pink Post-its, I would like you to, we're going to think quietly for a couple of minutes and think about the times when trust has been damaged, either from your side or from the side of, or when you've unintentionally damaged trust with a partner. So a partner's damaged trust with you, or you've damaged trust with a partner. In those pink sticky notes, drop some of the things that break down trust between you and your healthcare facility partners. I would like for you to write one idea per note and take up as many notes as you want to. You can write on them by clicking, double clicking, left click on a note, or tapping on your click trackpad if that's what you have, and you can type into the note. So take up as many notes as you want to. We're focusing on the pink notes on the left side of the document first, but jot down the things that break down trust. The things that withdraw trust from your trust bank account. And again, this could be things that healthcare facilities do that make you lose trust in them. It could be things that health departments do that make the facilities lose trust in you. Small, everyday things that chip away at trust, or big, giant things that chip away at trust.
Hey, Laura, do you think we should screen share for folks that are watching the recording, or should I pause the recording?
We could probably pause the recording and insert a screenshot. It's sort of hard to see from.
Yep.
Yeah.
Okay. Got it. Pausing now.
All right. Actually, let me pop this out. Okay. All right, so let's take a look at what we have on the board here. These are the withdrawals that we named, and I'm curious to see if you scan it really quickly, what do y'all notice here? What do you notice about these withdrawals, these things that break down trust between the health department and the healthcare facilities? What do y'all notice? Lack of communication? Attitude? Juliana says it seems like generally not showing up or not holding up the end, your end of the bargain. Yeah. Yeah. I think that's come out in some of the presentation from Joy and Karina too. What else do you notice? Fear. There's definitely an element of fear. What else? Lack of understanding each other's needs. And we could flip that too. Lack of communicating one's needs to your partners. What else? I love seeing all the little things flying around here. I like this one, unprepared for a scheduled visit. Unprepared for a scheduled visit. And I'm assuming this is a health department has a visit with the facility and the health department shows up and the facility's not ready for you. Is that what that one means? And we can apply some of what we learned from maybe the iceberg for thinking about why the facility might not be ready for you. We could think maybe, oh, it's intentional. They're not ready for us on purpose. They're just trying to annoy us. Or maybe there's another reason why they're not ready for this visit that we scheduled. What else do folks notice? There's definitely a lot of sort of the lying, the hiding a bad practice, not self-disclosing, hiding. What are some of the things on here that come from the health department side? What are some of the things that you think you might do as a health department that break down trust with your health care facilities? And feel free to drop it in the chat box or come off mute. Someone's landed on being authoritative rather than understanding, and someone marked it 100%. So perhaps that's one way the health departments break down trust. What else? Agree. I see a thumbs up on agreeing to an optional conversation and showing up with hostility. Resource limitations in the chat box. Health departments use jargon that conveys elitism. Not responding to emails and phone calls. Not acknowledging enough of the things that facilities do well. Okay. All right. Oh, I see a couple more got dropped down here. Facilities would do their best performance when they receive the agencies, but not keep up with their practices. Yeah. And then the political climate, absolutely. So what we're going to do now is I'm going to send you into breakout rooms, your 2 breakout rooms again for just a few minutes. And you're going to move into thinking about your trust deposits. So if we zoom out a little bit on the screen, you'll see on the right side here is your deposits. And in your small groups, I want you to come up with things you can do to make deposits, to build trust with your healthcare facilities. On the yellow notes, if you click on them, you can write something in. I want you to write in the little things you can do regularly, like maybe weekly. On the green notes, I want you to think about monthly or quarterly relationship maintenance ideas. And on the blue notes, I want you to think about the grander gestures, the significant investments you can make in the relationship. In your breakout rooms, once you capture the ideas, you can take your sticky note and move it over into the section that it goes into. So you're going to have about 10 or 12 minutes in your breakout rooms to come up with as many ideas as you can for all of these. Don't worry, we'll document them and we will provide them back to you after the meeting. The idea here, they can be as big or as little or as silly or as realistic as you want them to be. But the idea here is to come up with as many ideas as you can to make deposits into your trust piggy banks with your healthcare facilities. All right. All right. I'm going to take down my board and I'm going to open up the breakout rooms. And it'll say 8 minutes, but you're going to have a little bit more than that. And we'll bring you back to wrap things up after that.
And for anybody who needs it, I just put the Miro board link in the chat again. A couple folks just joined us. It's there for you if you need it. And I'm going to pause the recording now.
Welcome back, everyone. We are in the final stretch. And it was really fun to see everyone's cursors moving around the board. Thank you. I'm just moving stuff around so that when I share my screen, it's a little bit easier for us to see everything. And I see one more person's typing up an ID over there. I don't want to rush you. All right. Let me get my screen ready to share. All right. All right, I'm gonna zoom in here first to the weekly ideas, and I'm just gonna ask folks, it looks like both rooms are kind of working on everything intermittently. So what is one small sort of regular consistent thing you can do on a weekly or even probably not daily basis, but hey, who knows? one small consistent thing you can do on a very regular basis to make a deposit into your trust bank account with your healthcare facilities? What was one thing that stood out to folks as an easy thing that you could do? Feel free to come off mute or drop it in the chat box. Or y'all have gotten so good with chatting through emojis on the on the sticky notes. I'll be looking for those too. What's one small thing that you think that you could do to make trust deposits with your health department or with your healthcare facilities? I see
I'll
one that
come
I like.
off. One thing I put was acknowledging like their time commitment and thanking them for their work. When a facility reaches out to us and asks us questions, I usually thank them for reaching out and asking us the question, because that's what we're here for. And just kind of like doing that consistently. Like, I know you're busy, so we appreciate you taking the time to do this. Thanks for working with us on this, because like we know that they are busy, and like that goes a long way.
Yeah, yeah. Anyone else?
I usually forward along webinar information, like from APIC or from our state. If I know our state has bi-weekly webinars, so just make sure they're probably already on the Siren Alert email, but just send it out anyways so they have kind of name recognition from the health department to make sure they know we're still thinking about them.
Oh, I love that. You know, that like that meme that you always have that one friend whose love language is sending you links to things. You know, you can be that friend as the health department. You can send those links. Yeah, I see inquiring facilities need support and being responsive to their requests. Yeah, yeah. Yeah, I see two on here that I know when I get in a rush and get really busy, I'm not particularly good at, and it's a good reminder to me that they're worth it. And that's the little things of acknowledging people and just saying, yep, I got your message. I heard you. I can't respond right away, but I see you and I heard you. And then the other one of asking people how they are and acknowledging them as humans and not just jumping straight into work. Those are two like really small things that that I know I can do a better job with and would help build trust with folks. Yeah. All right, let's move down here to the monthly. These might be a little bit bigger. Like maybe they take a little bit more effort on your part, but the deposit you get is a little bit bigger, right? The trust that you can gain is a little bit bigger with your health department. So, what stands out here to folks? What are some ideas that you have about these monthly or quarterly deposits you can make in your trust bank accounts with your facilities? I see one I'm really curious about, but I want to hear from y'all first. What's this tabletop exercise card? Is the person who put that on here?
Yes, it's just like the rooms that you place us. We meet with somebody from the facility. We kind of gather many people from different facilities and discuss a topic, like, for example, candida auris. So what do they know? Lessons learned, how we can collaborate with them to prevent horizontal transmission, how we collaborate with them on the PPS or the screening, just as an example.
Yeah, yeah.
But it's
Yeah.
also
But in
walking through a
person.
scenario, walking through a scenario. So what if
Yeah.
this happened in your facility? And then what would you do? and then have all the different players around a table, and they would walk the facilitator through what they would do in that situation.
Mhm.
And then at the end, they get critiqued on whether they they walked through the scenario appropriately.
Yeah, that definitely takes a lot more effort, right? Pulling off a tabletop exercise. And they can probably sometimes feel stressful because there is an element of assessment, but they can also, there are ways to do it so that they are, you know, fun and engaging and educational as well. Okay. And I love the idea of thank you cards or thank you emails too during those celebration times. All right, let's go down here to the annually. So, oh my gosh, sorry, y'all. My computer thinks it needs to update everything. And I can't tell if we can see all the update screens.
We can't. We're
Okay,
good.
good. Okay. Because they are blocking my view. So let me move them really quick. Okay. What about for the annually? These are big, you know, really big investments on your time. You know, this is the like, you know, going to the door, you know, the window with the boom box on your shoulder and serenading the healthcare facility. What are some big annual investments you can make to in your trust account to gain trust with your healthcare facilities? Oh, respirator fit testing. That is definitely a labor of love for your healthcare facilities. What else? What are some other big gestures that you can do to gain trust with your health facilities?
Anytime I've become aware of like physical materials or supplies, which is a little less common now than, you know, the heyday of COVID, but even after COVID, sometimes there'll be a giveaway from a disability rights group or something like that. And if I tell them, hey, you can get these, you know, even if they can't use it, let's say it was like a pulse oximeter or something like that, or I don't know, thermometer tips or anything like that. If I became aware of it, they're usually appreciative that I thought of them.
Yeah, definitely. And I see Nicole mentioned putting together resource packets in the chat box and sharing ideas and encouraging collaboration between facilities. And Maria, you actually mentioned something really important in what you just said there of the I wish I had more time. And I'm going to zoom out here for just a second. And the biggest takeaway that I want you to take from this activity before we move into the closing is that if you look at these two lists here, what I want you to remember is that most trust deposits take time. They cost time, not money. And that most trust withdrawals happen because we're too busy to make deposits. There are plenty of little things that we can do to make deposits that don't cost a lot of money. Keep that in mind. All right. I'm going to stop sharing that screen and transition us back over to the slide deck. All right, 1 second. Okay. And we are moving into the closing session for today. So we've made it. We've made it to the end. Congratulations. We are here. You can give yourself a round of applause. All right. So just as a quick recap, we started out today chatting with our quick introduction. So we had an opportunity to meet one another. I hope that you met a couple of really cool people as we were chatting today. Then Joy talked to us about why partnerships are so dang hard. Karina talked to us about why partnerships are so dang hard. And then Joy talked to us a little bit about the spectrum of partnerships and where some of ours might fall along that spectrum. We also learned about how we can build trust with others and that external work. And then we learned about some internal work, how we can look within and think about how we show up in spaces to build trust with our partners in healthcare facilities. And then we pulled it all together, thinking about trust as a piggy bank and how we can make deposits so that when we do, because of circumstances, make withdrawals, we're a bit more resilient in those situations. All right, we have a quick reflection that we want to do. So I'm going to drop the Menti in the chat again. All right. Dropping the Menti link in the chat. So if you go here, we have a poll for you. So what was one aha moment that you had about your partnerships today? What was one aha moment that you had about your partnerships today? You can find the Menti link in the chat, head to it, and just share one aha moment that you had about your partnerships today. People are walking away with the idea that change starts with themselves, some ideas about how they can connect with their healthcare facilities. This kind of level set that we really are all doing the best that we can. The TRUST acronym. The spectrum, this idea that partnerships, there's a spectrum of partnerships and they all have a place. Hope for repairing damaged partnerships. We're not alone. Small, easy things to do, simple things to do, that trust is important. Great, this is wonderful. How easy it is, difficult it is to build trust and how easy it is to lose it. Comment in the chat box. Wow, that's really powerful. All right, on the next screen, one more reflection question for you. It's taken a second to load. What's one thing you will start doing to enhance your partnerships with healthcare facilities? So what's one thing, one small thing perhaps, that you can start doing to enhance your healthcare relationships? Listen to their needs and ask questions. Thank yous, asking for feedback, acknowledging them when they reach out. Being friendly, asking how you can support. Reaching out more. And you know what I notice about all of these things? These don't cost anything. They don't cost a dime. You don't have to put these into your budget at the health department. All right. Well, thank you, everyone. I am going to hand it over to Jennifer now to close us out.
Thanks, Laura, Dr. Joy, and Karina, and thanks all of you for sticking through to the end. We really appreciate your engagement. Laura's going to put a link to an evaluation in the chat in a moment. If you can take just a minute to fill it out, it should be really quick. And I want to leave you with one reflection that I've had as we've walked through the day. And that is that often we talk about soft skills as if they're a little less important than hard skills. And really, I have discovered that these are the essential skills for public health. Without trust, without relationships, we're not going to get anywhere. And so that's where the real work happens. And it's also where it is so easy to let go, because our to-do list, I don't know about you, but my to-do list right now is, from here to the floor and beyond. And so the softer side of like reaching out and checking in with people feels less important than the to-do things. But what I've learned is it's actually more important than the to-do things. Also, one of the pieces of advice I've got many years ago that has stuck with me and that I think about and try to practice all the time is that the best way to earn trust is to give trust. And that means taking a leap and trusting an organization or a person that you might be nervous to trust. But taking that risk is a way to earn trust for yourself. I find myself often allowing, providing responsibility and ownership of an issue to somebody else, but feeling very nervous about it myself. But that's the way to build trust. And so I would think about, if you can imagine, are there times in your life, whether it's professional or personal, that you can think about building trust by first giving trust? I'm so glad that you all were here and spent some time with us today. We're going to share we'll share the recording and the slides. We have a few additional resources as well about partnerships that we'll be sharing in a follow-up email. So thank you all for being here, and I hope you have a wonderful rest of your day.